Hi, this is Dr. Nagy from the Nagy Orthodontic Academy, and in today's video we are going to talk about cephalometric tracings. This is an important part of your orthodontic diagnosis. So we're going to be using the Dolphin software, and this is Dolphin imaging and Ceph tracing and model analysis. And just for the demonstration purposes, we'll be using this software. It's Dolphin Image 11, version 11. And you can use any software you like. You don't have to use Dolphin, but I just like Dolphin. We have used it for years and it works really well. But you're welcome to use any software that you would like. If you are using Dolphin, then this will be helpful so you can get familiar with the software if you haven't been using it very long. Just a quick overview for the software. This is where you select the patient. If you don't have the x-ray imported yet, you just come to capture, and this is how you import your images here, and we'll have a separate video just on that. But I just wanted to show you real quick. These are the different timelines. You can name these tabs anything you'd like, and as your patient goes through treatment, you can have different dates of different timelines with your progress records. We recommend taking progress records probably every appointment or every other appointment, especially when you're starting out. So this is just a quick overview of the Dolphin software, and we are going to be doing the cephalometric tracings here. Now, when you're doing cephalometric tracings, there's just so many different analysis that sometimes a lot of people kind of get confused which one to use. So instead of worrying about what analysis to use, first I think it would be a good idea to figure out what information you're trying to get. Well, one of the reasons some of the reasons you're doing the cephalometric analysis is to diagnose skeletal malocclusions, as well as diagnose some dental malocclusions. So namely, you really want to know what's the relationship of the maxilla and the mandible to the skull. Is it too far forward? Is it too far back? Is it ideal? And then you would like to know how the two relate to each other. How does the maxilla relates to the mandible? Are they, is the maxilla too far forward, too far back, or is the mandible back compared to the maxilla? And there's certain measurements that helps you determine that. Namely, if you're looking for maxillary position, is the SNA, and we'll talk about that a little bit, sella, nasion, and A point. This is about A point. So you go from sella, nasion to A. That tells you the position of the maxilla. If you're trying to determine the position of the mandible, that's more from sella, nasion, and B point. This is B point at the deepest curvature of the anterior part of the mandible. If you are trying to decide the relationship between the maxilla and the mandible, then you're looking for a measurement which is more A and B. That's from A point, which is at the curvature of the maxilla. It's about 1 to 2 millimeters in front of the root tip of the incisors, to B point, so A and B, and that tells you if it's a skeletal class 1, class 2, or class 3 patient. Now, also, the other thing that's important to determine is does your patient have a deep bite, or do they have open bite? So FMA is what tells you if a patient is more open or deep or average, and then it's just the mandibular plane to the Frankfurt horizontal, and then that helps you determine if a patient is open or deep or average bite skeletally. And remember, the closer your patient is to skeletal class 1 average bite, the easier it is to treat them to dental class 1, which is what our goal is. So you need a couple of these measurements. Also, it would be a good one to know how long is the patient's mandible, especially if they have a class 2 relationship where the jaw just seems small or too far back. Sometimes patients have a shorter mandible, and you have these measurements from condyleon to gnathion. So condyleon is on top of the condyle, most posterior superior point, to gnathion right here, and that tells you the length of the mandible. And then you have a couple of dental measurements too. It's from the Ceph, it's very important to diagnose proclination of the anterior teeth. So upper 1 to SN will tell you if the front teeth are proclined, ideal, or retroclined, and the lower 1 to MP will tell you if it's lower 1 to mandibular plane, which is here. It will tell you if lower incisors are proclined. Proclined teeth are particularly anesthetics, and a lot of doctors tend to struggle with seeing the proclination, and the proclination of the anterior teeth, which is how far forward they are tipped, is very hard to see on pictures. It's really Ceph is a much better way of diagnosing that. And if you have your patient already starts out with proclined teeth and they have crowding, then you're really going to have an issue that you're going to have too much proclination. And why is too much proclination bad? Well, it's bad because with too much proclination, you have quite a bit of unstable environment. You know, the teeth just don't want to stay there, and it's very anesthetic. It doesn't look good, and it's also very hard on a gingival tissue. There's easy to get attachment loss with proclined teeth. So proclination is just not a good thing to have in your orthodontic cases, and there's certain ideal measurements for these different variables, and I just highlighted a couple here. You need, depending on your case, you're going to need more measurements, but these are the basic important ones that it will be good to have these informations just to get a good feel for what kind of malocclusion your patient may have. So well, good, and we're not going to cover the details of the cephalometric analysis here. We're just covering how to trace the X-ray. We're going to have a different seminar or different course where we are going to cover how to analyze the X-rays, and it's a little bit more involved than just a few minutes of demonstration here. So we are going to cover that separately. So the purpose of this video here is really to get you familiar how to trace the Ceph and what analysis to look for. So good. So if so we kind of covered shortly what are some of the information that you need from the Ceph. Now, how do we analyze it? Now, before we analyze the Ceph, I want you to kind of look at it first and notice something. If you look at this patient looks like they're looking just up a little bit. Their face just looks like it's tipping up. If you had a mirror in front of the patient and the patient was looking directly into a mirror, that mirror doesn't seem to be straight vertical. This patient looks like they're looking up a little bit, and this nose rest should be at nasion, and it's a little bit too far down because the patient is looking up. So we are going to have to reorient this X-ray so the head is oriented perfectly, so like if a patient was looking into the mirror. So so the patient's face should be parallel to like a mirror that they're looking into, and right now this patient looks like they're looking up a little bit. So we are going to have to reorient this X-ray as part of the tracing. So I wanted to point that out before we start, because you want to discover this kind of problem before you start your tracing. Now, the other thing you want to look at is make sure your patient is biting together. So if you look at the teeth here, the lips and the teeth should be together. So you want to make sure, I mean, if the patient has anterior open bite, of course, they could still be biting and have an open bite, but they just can't have two open arches, because that's going to really throw off your measurements. So the patient needs to be looking straight forward, like if they were looking into a mirror, and the teeth needs to be together, so you get accurate measurements. So good. So those are the two things I wanted to point out before we start. Now, once you're ready to start your tracing, you just have to click on digitize. And in the Dolphin software, you're going to have these are all your different cephalometric analysis that you can choose from, and there's several different ones that would work just as well as the others, and there's really no preference that I have, as long as you get the right information that you're looking for. And before we start, I wanted to point this out. Your Ceph needs to have a ruler, because that's how you're going to calibrate your tracings for measurements. So if you have like a virtual Ceph from CBCT, you're going to need to put some kind of ruler on it so you can calibrate your measurements. So you're going to click digitize, and then we're just for demonstration purposes, we are going to pick the UNC tracings for this patient. That's just a tracing that's going to give us all the information that we need. And then for ruler length, try to pick the longest length that's possible, that you can see on your Ceph. So for example, this ruler has, they come in 5 increments, so this has 5, 10, 15, 20, 25, 30, 35, 40. So this ruler, I can see about 40 millimeters. So when I go to digitize, I'm going to put in 40 here, because we're going to pick the longest length possible, because that makes it the most accurate. So you're going to pick ruler, you're going to put in 40, and then we're going to pick our analysis, which is in this demonstration is just going to be UNC. And I'll tell you why I happen to like UNC for these demonstrations. It breaks down your analysis to skeletal, dental, vertical, so it's just really easy to see what your patient has. So, but you can use any of the different analysis that you can see here on Dolphin that gives you all the right information. But for this demonstration, we'll just use UNC. We pick the ruler, and then we put in our ruler length, which is 40, and then we're going to start the analysis. Now, the first thing we're going to need is we are going to need to put the ruler points on, and this is just your cheater sheet here, and it's going to tell you the different points. And I'm sure soon enough you will not even need to know the points. Some computer program's going to find all the points, but until then we do need to know where the landmarks are located. So your first point, Dolphin is telling you that it's ruler point 1, which is for your calibration. So this is going to be the first part. And remember, we picked 40 millimeters, and there's a magnification window here that lets you see. So we're going to have to count 40 millimeters here. So that's 5, that's 10, that's 15 to 20, 25, 30, 35, 40. So now we got 40 millimeters. Now we are going to need to pick our vertical line that's going to help us determine where is the imaginary mirror that the patient is looking into for the correct head orientation. Like we said, this patient is looking up a little bit, so the vertical upper is just going to be a random point in the upper, and we're just basically drawing a vertical line, and this vertical line needs to be basically parallel to the face. So if you look at this would be just a true vertical line. That's not really parallel to the face, because this patient looks like they're looking up. So if you put a mirror in front of this patient's face, and you have to pick like a line where the patients will be looking into a mirror, that will be about this line. And this line is important because this is the line that's going to reorient your x-ray. So at the end of the tracing, once we done with all the tracing, it's going to help us reorient our x-ray for patients who are not looking straight forward. So again, this is just a vertical line, and it needs to be a representation of the parallel line to the face of the patient. So in this case, patient's looking up, so we just put the vertical line in a little bit of an angle that's parallel to their face. Now good. So the next point is going to be porion, and here you can see Dolphin is giving you the name of the point, and which is just really the highest point of the ear canal. So here is porion. Now the easiest way to find porion, depending on the x-ray, sometimes it's not that easy to see. You can follow the mandible to the condyle, and it's posterior to the condyle, and it's the highest point of the ear canal. So it's about right there. Now after that, we're gonna look for orbitale, which is the lowest point on roof of the orbit, and the most inferior part of the external border of the orbital canal. So that's about right there. And then we're going to have PT point, intersection of the inferior border of the foramen rotundum with the posterior wall of the pterymaxillary fissure. So you can basically, the way you find that is look for the maxillary sinus, and you come kind of posterior from the orbit, and it's about right there, and you can see it in your magnifying glass a little bit. And once you traced a lot of these cephs, you will get better at seeing this. But make sure go and cheat off of your cartoon that Dolphin is giving you. And by the way, if you think you put a point in the wrong place, you can go back just by navigating here. So if you think you put your ruler point in the wrong place, you can go back and you can toggle back with these. We already did Porion, but if you think it's in the wrong place, you can move it and then see it changes your horizontal line. So we're going to put Porion back, and then we were at PT point, and then the next one. So if you want to go to your next point, so right now you're kind of stuck because we changed a couple of points. So you can simply just click next, and it will tell you sella. So which is sella is the center of the theotery fossa of the sphenoid bone. So that's right there. And then you can make little flashcards to memorize these landmarks, but Dolphin's kind of giving you the cheating hints, so you can cheat off of this little cartoon presentation. So we get nasion, which is the intersection of the internasal suture and nasofrontal suture, and you're looking for the bony landmark, not the soft tissue one. So it's right there. And now you're going to need basion, and it's about right there. And then you're going to need soft tissue glabella. It's the most anterior point of the frontal bone. And you're looking for a soft tissue landmark. So this is bone and this is soft tissue. If your ceph is not calibrated correctly, you can actually wash out the soft tissue so you can't see it, and then you wouldn't be able to see this landmark. So you need to calibrate your ceph so it shows up the soft tissue really nicely. And you usually get what's called a tissue shield that you need. So this, if you don't see the soft tissue in your ceph, you're going to make sure that you have a tissue shield. If you have an older machine, on a digital machines, it's not so much of an issue. But if you have a analog or film-based ceph, which is okay, just make sure that you have the tissue shield that helps you identify this soft tissue landmark. Well, good. So then we get a soft tissue nasion, which is just anterior to the bony nasion, and that's basically where that's the midpoint from the soft tissue nasion to the tip of the nose. That's going to be our next point, which is the bridge of the nose. But going back to the soft tissue nasion, it's a concave. It's basically the most concave point above the bridge of the nose, like in the very top of the bridge of the nose, kind of like a little bit higher where your glasses would sit, and that's where this nose rest should sit as well. So then you get the bridge of nose, and now one thing that you will notice here, and Dolphin draws these structures for you, so because it doesn't draw it completely accurately, you can move these points and outline the exact anatomy of the patient, kind of like that. Dolphin just automatically puts the structure on your ceph after you pick the point for the bridge of the nose, and you do have to change it sometimes because in some patients it's really skinny, some patients in a different insertion spot, so you do need to change this a little bit. And after this you have the tip of nose point. Subnasally is basically the nose connects to the center of the upper lip, so you follow the nose down and then you come here. Then you're gonna need soft tissue point A. It's basically right about here. It's between it's basically between subnasally and the anterior point of the upper lip. And then you're gonna need to place the upper lip point, which is just right about here, at basically the top curve of the upper lip. And then stomion, it's basically where the lips come together. And now see, as soon as I clicked on stomion, Dolphin drew the line in for the upper lip, but it's not correct because it's telling you that the upper lip is going into the teeth. So we're gonna have to grab this point and move it. See, I can move this out of the way, and I just want to outline the lip as it is exactly on the ceph. So good. Now we're gonna need the lower stomion. Now, if I want to put the lower stomion basically where the lips come together, they would be on top of each other, but I can't click here because if I click here, I would be moving the previous point, which is the upper stomion, but I need the lower stomion, and they need to be, in this case, the lips are coming together, so they would be on top of each other. So what do I do now? Well, one thing you could do is you could put this point more anterior, and then simply hover over it until you see these four arrows, and then you just simply drag it. So I just basically put my point somewhere else, and then I just drag it. And let me show you how to do that. And then you can go to the next point, which is going to be lower lip, which is the most anterior point on the curve of the lower lip. Again, if you can't see it for some reason, you could put it on the side, like I just put it on the side here, and then you can drag it like that. And then your next point is your soft tissue B point. So B point is really the deepest curvature of the mandible, and a soft tissue B point will be just anterior to that. So that's your soft tissue B point. Soft tissue pogonian, that's the anterior curve of the soft tissue of the chin. Okay, so it's right there. And then we're going to have the soft tissue gnathion. It's the most anterior and inferior point of the soft tissue chin in a mid-sagittal plane. So it's about right there. And you can, I suggest that, I don't want to spend a lot of time here because I'll put everybody to sleep, but each of these points have a description, and we are going to cover that in our mini residency class and some upcoming online courses as well. But each of these points have a description, and the best thing to do is either use our manual as a reference, or you can simply Google it, or use our required textbook, which is the Profit and Fields and Sarver Contemporary Orthodontics textbook. But you can find the description of these points, any of these texts, or simply just follow the instructions that Dolphin is giving you. So you don't really actually need any extra textbooks, but if you want like a description of each of these points, you want to do that on separately from this video, because we can spend all day describing every single point in the cephalometric tracing, and each tracing has a little bit of different or additional points. I mean, A point is always A point and B point is always B point, but some of the cephalometric tracings use different landmarks. So good, so let's keep pressing on here. And so then you're going to need a soft tissue menton, which is the most inferior point of the soft tissue of the chin. So if you follow the chin, this is of course the mandible, so you want the soft tissue chin. If you look at the outline of the chin, it's about right there. So that's the menton, and then you have what's called a throat point. And once you've done enough of these tracing, you'll memorize these points, and it's really gonna go quite quickly. I'm just taking my time here to do it slow so you can follow along if you have Dolphin or if you're using any other software. So you could kind of follow on your screen, and we could do this together. So I'm kind of trying to pace myself here. So the throat point is basically if you follow menton from the chin all the way until you get to the neck and the throat. So you just follow the chin, and it's kind of hard to see. It starts getting washed out on this x-ray, but it's probably about right there. It's not that crucial because there's no measurements made from this point. So if you put it here, if you put it there, it's mainly just for make the picture look nice. There's no measurements that's being taken from there. Now look here, our lip is messed up a little bit because this point that the software puts on is not quite accurate where the lip is. See, the lip comes back to here, not to down here. So I'm gonna hover over the lower lip inside point, and I'm gonna drag it. See, I can drag this to outline the lower lip. So good. So then we're gonna need B point, which is the deepest curvature of the mandible, and you can read the description: most posterior point on the concavity of the anterior border of the symphysis of the mandible. So you go to the deepest curvature, which is about there. Then we're gonna need pogonion, and pogonion is the most anterior point of the mid-sagittal symphysis of the mandible. And then we're gonna need gnathion, anatomical gnathion, which is the midpoint between the most anterior and inferior point of the chin. So this is an important landmark because if you remember, the length of the mandible is being measured from condylion to gnathion. So that's an important point to put on your ceph. And then we're going to need menton, most inferior point of the symphysis, which is about right there. And nagonion, depending who you talk to, you can have a constructed gonion, which is you follow the mandibular plane and the posterior part of the ramus, and the intersection will be your gonion right there. Now some and then on some doctors will put most convex point where the posterior inferior curve of the ramus meet. So so some people would gonion here, or you could use the most convex point along the inferior border of the ramus. So I tend to use constructed gonion, which is you follow the mandibular plane and the posterior part of the ramus, and that's your constructed gonion. And then you're going to have the ramus point, which is just the most posterior point of the border of the ramus. And then you're going to have the mid-ramus point, which is just the most concave point on the interior of the ramus. So that's about there. And then you're going to have the sigmoid notch, which is the most inferior border along the top of the ramus. So you can locate the condyle, and then you go to the most inferior border of the ramus, of the sigmoid notch. And then you're going to have articulaire, and that's the posterior border of the neck of the condyle. So you keep following the mandible up until you come here and you find the posterior border of neck of the condyle, which is about right there. And then you're going to have the condylion, which is the most posterior superior point of the condyle. So most posterior, so the most back and most top. So most back and top, so that's about at where it starts curving over. So about there. And then you're going to have A point. Now for A point, sometimes from these lines you can't see it, so you're more than welcome to move this out of the way. All I'm doing is I'm just dragging that point because I can't see A point very well. So what I'll do is I'll follow the incisors, follow the roots all the way up, and you start seeing this curvature here. And A point is just the deepest point on the curvature of the maxilla between the anterior nasal spine, which is here, and the dental alveolus. So you can see this curvature here, and but right there is A point. Now I moved this, and this is nasion, so now I have to move it back because I just moved it out of the way so I can see better. So you want to make sure that you move it back. Now you're going to have ANS, which is the tip of the anterior nasal spine. So you follow A point up, and it curves forward, and it's right there. Okay, and then you're going to use PNS, which is the tip of the posterior nasal spine. So you're going to follow this straight to the posterior, and it's right there. And then we're going to need occlusal 6, so your upper 6. Now sometimes if you have asymmetry in the arch, or your patient turned their head in a ceph, it's going to be a little bit washed out. So basically this patient has their 7s and the 6s, and then you can see the 4, the 5, and here's the 6. So you need the occlusal of the 6, the mesiobuccal cusp tip of the maxillary molar. So you're going to look for the mesial cusp tip, which is right there, and then you're going to look for the mesial-buccal cusp tip of the mandibular molar, the lower molar. So that's about almost there too. So we can click it. So when I click it somewhere else, and I just end up moving it. So mesial-buccal cusp is just a little bit anterior to that molar, so about right there. And then we're gonna need the distal surface of the upper first molar. So the distal surface would be about there, and then you're gonna need the mesial of the upper 6. And then Dolphin's gonna draw your upper 6 here, and if you want to rotate it, you can move that. I'll show you that in a second how to do it. And then you're gonna have the distal of the lower 6, and then you're gonna have the mesial of the lower 6. Okay, so now these teeth are a little bit crooked, so what I'm doing is I'm just simply tweaking these points so the teeth outline what's on the x-ray. If you need to move the tooth, you can grab it with these blue circles, and basically just want to outline what you see on the x-ray. Good, and then you're going to have the upper first cuspid point, so you're going to look for the upper 4. It's there, and then you're going to look for the cusp tip of the lower 4, which is about here. And then now you're going to work on the lower teeth. So you got the labial gingival border of the lower one, which is basically at the CEJ of the lower incisor, so that will be here. And sometimes when you have crowding, it's not that clear to see because the teeth are kind of overlapped. So try to maybe pick the average or the most anterior one, and then you're going to have the lower one tip. So you follow your lower incisor, and then you're going to have the point for the lower one root apex for the lower central incisor. And if you're not happy with the outline, you can kind of tweak it. And then good. So now we're gonna place the lower gingival border. So basically we're gonna follow the lower one on the lingual, and where it meets the CEJ on the lingual, we're gonna click there, and Dolphin automatically draws the bony borderline for the anterior part of the mandible. If it's off, you can move it, and you can kind of move these points, make sure it outlines the true bony structures, because remember, these are the limits of tooth movement. So once the tooth would run into these bones, this is a strong cortical bone, like here, the tooth wouldn't be able to move through that. So it's important to draw these bony structures correctly. Good, and then we're gonna have the upper labial gingival border. So that's basically at the labial CEJ of the upper central incisor. So that's here, and then you're going to have the incisor